Before you look down at your hands today, there's something you need to know. Because one of the earliest warning signs of Sjogren's syndrome may have nothing to do with dryness at all. It may not show up in your mouth. It may not show up in your eyes. It may show up in your fingers, for a few minutes, at a time you don't expect, and then disappear so completely that even you start to doubt what you just saw. No mark. No proof. Just a memory that starts to feel less real every hour that passes. Today I'm going to show you exactly what this sign looks like, why it fades so fast that most people never mention it to anyone, what it might actually be telling you about what's happening inside your body, and the one simple habit that turns it from something you forget into something that could genuinely speed up your diagnosis or your care. And if you're one of the millions of people living with Sjogren's, or you suspect you might be, make sure you're subscribed. Every week we break down research and practical strategies to help you understand what your body is actually trying to tell you. Let's get into it. I built something specifically for not just tracking and doctor's appointment. It is called Sjogren's Ultimate Symptom Map and Diagnostic Action Plan, and it walks you through exactly which symptoms to track not just for Sjogren but also for MS and RA. Drop symptom map in the comment, and I would send the link for you to access it. Let's get back to the research. Before I even describe it, I want to say something to anyone who's already sitting there thinking, wait, that's happened to me. If part of you just felt a flicker of recognition, hold on to that. Trust it. So much of living with Sjogren's is a slow, exhausting process of being told your symptoms are probably nothing, probably stress, probably just how bodies work sometimes. And after enough of that, a lot of people start doing the doctor's job for them, quietly deciding in advance that something isn't worth mentioning. This video is about one specific thing that deserves to be mentioned every single time it happens, starting today. First, let's talk about what this sign actually looks like, because most people who experience it don't connect it to Sjogren's at all. It usually starts in the fingers. Sometimes the toes. Out of nowhere, without warning, one finger, or two, or three, turns pale white. Almost bloodless looking, like the color has simply been switched off. If you've experienced this, you already know the feeling I'm describing. It's a little startling the first time. You hold your hand up, you flex your fingers, and it just looks wrong. Within a minute or two, that white shifts into a dusky blue, sometimes closer to purple, almost like a bruise forming in real time without any impact. Then, as blood flow finally returns, it turns bright red, sometimes with a throbbing or tingling sensation, almost like pins and needles waking back up. And then, just like that, it's over. Color back to normal. No mark. No bruise. Nothing left behind to prove it happened. The entire sequence, start to finish, can take under 10 minutes. I call this the tricolor tell, because that white to blue to red sequence is the signature, and once you've seen it, you'll recognize it instantly every time it happens again. Here's why this sign is so easy to dismiss, and I want you to really sit with this for a second. By the time you think to show someone, your hand already looks completely normal again. By the time you think to take a picture, the moment has often already passed. So what do most people do? They shrug it off. They tell themselves it was just the cold, or nothing, or their imagination. And here's the part that stings a little. Sometimes it gets dismissed even in appointments, not because anyone doesn't believe you, but because there's genuinely nothing left to examine by the time you're sitting in that room. You're describing something invisible, and invisible symptoms are the hardest ones to advocate for. Think about how this plays out in real life. It's a Tuesday morning. You reach into the freezer for something, and by the time you close the door, your fingers have already gone pale. You stand there for a second, mildly unsettled, watching your own hand cycle through colors like it belongs to someone else. Then your phone buzzes, or your kid calls from the other room, or you simply need to keep making breakfast, and by the time there's a quiet moment to even process what just happened, your hand looks completely ordinary again. There's nothing dramatic about the aftermath. That's exactly the problem. The lack of drama afterward is what makes it so easy to file away as nothing, when it isn't nothing at all. So let's make sure you actually know how to tell this apart from just having cold hands, because that's the question I know a lot of you are already asking. Regular cold hands feel uniformly cold, all over, and they warm back up gradually and evenly as you rewarm yourself. There's no sharp line, no dramatic staging. What I'm describing is different. It has a sudden, almost switch-flipped onset. There's often a clear, visible border between the affected part of the finger and the unaffected part, almost like someone drew a line partway down your finger. And it moves through that distinct color staging, white, then blue or purple, then red, rather than just gradually feeling chilly and slowly warming up. If what you've experienced matches that sharper, more dramatic pattern, that's the sign we are talking about today. Now, what you're actually seeing has a name. It's called Raynaud's phenomenon. It is not unique to Sjogrens. Plenty of people experience this with no autoimmune disease at all. But in the context of Sjogrens, it matters more than most people realize, and I want to walk you through exactly why. Here's what's happening under the surface, in plain terms. In Raynaud's, the small blood vessels in your fingers and toes overreact to a trigger, usually cold, sometimes stress. Instead of narrowing slightly like they normally would, they clamp down hard, and they hold that clamp longer than they should. That's what cuts off blood flow to the point where the skin turns white. As those vessels stay constricted, the blood that's still trapped underneath becomes oxygen depleted, and that's what creates the blue or purple color. Then, when the vessels finally relax, blood rushes back in all at once, and that surge is what creates the bright red flush, sometimes with that throbbing feeling as circulation restores. It's a vascular overreaction. And in people with Sjogrens, the leading theory is that the same underlying immune activity responsible for drying out your glands also appears to make these blood vessels more reactive, more prone to this kind of overcorrection. Now let's look at the actual numbers, because I want you to see how real and how common this is, not just take my word for it. Research on Raynaud's phenomenon in primary Sjogrens has found it in anywhere from 9 to 33% of patients, depending on which study you look at. I know that's a wide range, and if you're the kind of person who notices that, good, you should notice that. Here's why the range is so wide. Different studies define and count Raynaud's differently. Some rely on patient self-report, some rely on clinical examination, some pull from newly diagnosed patients only, others from long-term cohorts. That variation isn't a red flag about the research, it's just how prevalent studies work when a symptom is this hard to catch and confirm. But here's what matters. Even the most conservative numbers still land around 1 in 10. In one large series of 320 Sjogrens patients, it was present in 13%. In a separate study of 333 newly diagnosed patients, it was found in just over 11%. Other estimates, pooling multiple sources, put it as high as 15 to 30%. So depending on which study you trust most, that's somewhere between roughly 1 in 10 and 1 in 3 people with Sjogrens. Either way, this is not some obscure, rare footnote. This is a real, recurring feature of this disease that doesn't get talked about nearly as much as dry eyes and dry mouth do. Here's the part that should really get your attention, and I want to be precise about what this stat actually means. In that same 320 patient study, researchers looked back at the patients who had Raynaud's, and found that it had come before the dry mouth and dry eye symptoms in 45% of them. Nearly half. Now, I want to be careful here, because this is where it's easy to overstate the finding. This is a retrospective observation. It means that in patients who were already diagnosed with Sjogrens and who already had Raynaud's, when they looked back, close to half of them realized the color-changing episodes in their fingers had started before anyone ever said the word Sjogrens out loud. It is not a claim that everyone who experiences this will go on to develop Sjogrens. Most people with Raynaud's never develop an autoimmune disease at all. But for people who do have Sjogrens, or who are in the process of trying to get answers for dryness, fatigue, or joint pain they can't otherwise explain, this pattern is worth knowing about. If you're someone who has noticed this happening and never once mentioned it to anyone, not your doctor, not your family, comment cold below. I genuinely want to see how common this actually is in this community, because I suspect it's a lot more common than the research alone suggests, simply because so many people never report it in the first place. The research also found something else worth knowing, something that changes how seriously this sign should be taken once it does show up. The main trigger for these episodes was exposure to cold, which set it off in essentially every patient who experienced it. Emotional stress was the second most common trigger. And here's the part one think matters most. People with this sign tended to also show higher rates of joint pain, skin vasculitis, and positive markers on blood work, specifically antinuclear antibodies, and the SSA and SSB antibodies that are strongly associated with Sjogrens. In other words, this isn't just a random cold hands moment laid on top of an unrelated disease. In the context of Sjogrens, it tends to travel together with a more immunologically active version of the condition. There's one more finding worth knowing, not to worry you, but because it's exactly the kind of thing that makes mentioning this sign genuinely useful rather than just symbolic. Some research looking specifically at Sjogren's patients with this sign found that they were diagnosed at a younger age on average, and showed a higher rate of lung involvement compared to Sjogren's patients without it. That doesn't mean this sign causes lung problems, and it doesn't mean everyone who experiences it needs to panic about their lungs. What it means is that, statistically, this sign tends to cluster with a specific subset of Sjogren's presentations, and doctors who know that will sometimes use it as one small piece of a bigger picture, alongside your other symptoms, to decide what else might be worth checking. That's the whole value of mentioning it. It's not about this one sign in isolation. It's about giving whoever is treating you the full picture instead of a partial one. Now, I want to pause here and address something directly, because I don't want to leave this hanging the way it's easy to when you're presenting research like this. If you already have Sjogren's and you already experience this sign, I don't want you walking away from this video thinking that means your disease is automatically worse, or that something bad is happening that you need to panic about. That is not what this means. What it means is that this sign is a flag, not a verdict. It's information that helps a doctor decide whether it's worth running a few additional blood tests, or keeping a slightly closer eye on certain symptoms. It does not mean your day-to-day experience of the disease has to change. It does not mean you're heading toward a worse outcome. It means you have one more piece of useful information, and useful information is never something to be afraid of. It's something to use. So here's the practical part. Here's exactly what to do the next time this happens to you, step by step, starting with the single most important habit in this entire video. Step 1, take a picture. The second you notice your finger changing color, however inconvenient the timing, however busy you are, get your phone out and take a photo. This is the single most useful thing you can do, and here's why it matters so much. This sign disappears completely, and a doctor cannot examine what isn't there anymore. Describing a symptom from memory, days or weeks later, is one of the weakest forms of evidence you can bring into an appointment. A photo turns a symptom nobody else witnessed into something you can actually hold up and show someone. Try to capture more than one stage if you can, the white phase and the blue phase especially, since those are the most distinctive. A couple of quick tips that make these photos far more useful. Take them in regular daylight if you can, since indoor lighting can wash out or exaggerate color changes and make them harder to interpret later. If only one hand is affected, snap a quick photo of the other hand too, right next to it, so there's an obvious comparison rather than just one image a doctor has to take your word on. And don't worry about making it look professional. A slightly blurry, hastily taken photo of the actual moment is worth more than a perfectly composed photo of your hand looking completely normal an hour later. Step 2, note what you were doing right before it started. Were you cold? Were you holding something cold, like a drink straight out of the fridge, a steering wheel on a winter morning, or a bag of frozen vegetables at the grocery store? Were you stressed, anxious, overwhelmed, or in the middle of a difficult conversation? This context matters enormously, because cold and stress are the two most common triggers identified in the research, and a documented pattern is far more convincing, both to you and to a doctor, than a single isolated incident. Step 3, time it. You don't need a stopwatch for this, just a rough sense of how long the color change lasted, and roughly how often it's been happening. Once a month is a very different clinical picture than several times a week. Duration and frequency are two of the first questions a doctor is going to ask you, and having even a rough answer ready puts you miles ahead of trying to reconstruct it on the spot. Step 4, build a small log. This can be as simple as the photos already sitting in your camera roll, each one naturally time-stamped, maybe with a one-line note added afterward about the trigger. Over a few weeks, that stops being a handful of confusing, disconnected moments, and starts becoming a pattern. And patterns are what move conversations with doctors forward. A pattern is evidence. A single memory is not. Now, tracking this isn't the only thing you can actually do here, and I don't want you walking away thinking your only option is to document it and wait. There are real steps that can reduce how often this happens in the first place. Keeping your hands and feet warm proactively, not just reactively, matters more than people expect. That means layering gloves before you go outside, not after your fingers already feel cold. It means keeping a pair of warm socks nearby even indoors if your environment tends to run cool. It means being mindful of air conditioning in summer just as much as cold weather in winter, since sudden temperature drops, like walking from a hot parking lot into an overcooled store, can be just as much of a trigger as winter itself. On the stress side, since it was the second most common trigger identified in the research, anything that genuinely lowers your day-to-day stress load, whether that's pacing your schedule differently, building in recovery time, or simply recognizing stress as a real physical trigger and not just a mental one, can meaningfully reduce how often these episodes show up. For some people, especially those with more frequent or more severe episodes, doctors do prescribe medication that helps relax these blood vessels. That's not something to self-manage or guess your way through, that's a conversation to have directly with whoever is treating you, once you've brought them the pattern you've documented. Which brings us to the question I think matters most, and the one this video would be incomplete without answering. You've taken the picture. You've noted the trigger. You've built a small log. Now what? Who do you actually bring this to? If you already have a rheumatologist, this goes straight to them, at your next appointment or sooner if the episodes are frequent or severe. If you don't have a rheumatologist yet, and you're still in the process of trying to get a diagnosis or figure out what's going on with your body, this is exactly the kind of symptom that can justify a referral from your regular doctor. Raynaud's phenomenon, especially when it shows up alongside dryness, fatigue, or joint pain, is a recognized reason to ask specifically for that referral, rather than just mentioning it in passing and hoping it gets followed up on. When you bring it up, be direct. Something as simple as, "My fingers have been turning white, then blue, then red, especially in the cold, and I have photos," is a complete, clear, clinically useful sentence. Depending on what else is going on, that conversation may lead to blood work looking at those antibody markers I mentioned earlier, or in some cases a simple, painless test that examines the small blood vessels at the base of your fingernails. You don't need to know the details of that test right now, just know that it exists, and that it's one of the tools doctors have specifically for evaluating a sign like this one. It also helps to know roughly what might come next, so the appointment doesn't feel like you're walking in blind. A doctor hearing about this sign for the first time will often ask some version of the same questions we just walked through together: how often it happens, how long each episode lasts, what seems to trigger it, and whether it affects one finger or several. If you've been keeping even a rough log, you'll be able to answer all of that immediately, which noticeably changes the tone of these conversations. Instead of a doctor trying to draw information out of a hazy memory, you're handing them a clear, organized account, and that tends to be taken seriously, faster. Now let me address a few more questions I know some of you are already thinking, because I'd rather answer them now than have you left wondering. What if it doesn't turn all three colors, just white, or just a dusky color, without the full sequence? That still counts. Not everyone gets the complete white to blue to red progression every single time. Any repeated, sudden color change in your fingers or toes tied to cold or stress is worth documenting the same way, even if it's an incomplete version of what I described. What if it only happens in one finger, not several? Also still counts. Raynaud's can affect a single digit or multiple digits, and it can vary episode to episode. One finger doing this repeatedly is just as worth tracking as several fingers doing it at once. What if it happens even when I'm not cold, like in the middle of summer? That's actually useful information, not a reason to dismiss it. If stress or another trigger seems to be setting it off independent of temperature, that's worth mentioning specifically, since it may point toward a stronger stress-driven component for you personally. Does this mean I have scleroderma instead of, or in addition to, Sjogrens? I want to be careful here, because this is not something I can or should diagnose for you in a video. What I can tell you is that Raynaud's phenomenon shows up across several autoimmune conditions, not just Sjogrens, which is exactly why documenting it properly and bringing it to a doctor matters so much. It allows the right testing to sort out what's actually going on, rather than you or me guessing from a screen. Is this dangerous? For most people, most of the time, no. It's uncomfortable, sometimes even a little alarming to watch happen to your own hand, but not harmful in the moment. That said, there are clear thresholds where this stops being a simple watch and track situation. If these episodes are happening more than a few times a week, if a single episode is lasting longer than 15 to 20 minutes, or if you ever notice a sore or ulcer developing on a fingertip that isn't healing normally, that's no longer something to manage on your own timeline. That combination of frequency, duration, or skin breakdown is when this needs to be evaluated properly and promptly, not added to a log for your next routine appointment. Should I mention it even if it only happens rarely, like a couple of times a year? Yes. Even an occasional episode is worth bringing up, especially if you're already dealing with dryness or fatigue and don't yet have a clear diagnosis. Remember, for close to half of the people who eventually were diagnosed with Sjogren's and also had this sign, it showed up first, sometimes long before anything else did. Rare doesn't mean irrelevant. What if I have this sign but none of the other classic Sjogren's symptoms? No dryness, no fatigue, nothing else. That's still worth keeping in the back of your mind, not necessarily worth an urgent workup all on its own. Raynaud's phenomenon exists independently in plenty of people who never develop any autoimmune disease at all. The reason it matters so much for this audience specifically is that if you already have Sjogren's, or you're in the process of chasing down an explanation for symptoms that don't yet add up, this becomes one more piece of the puzzle worth handing over. It isn't a standalone alarm bell on its own. It's context, and context is exactly what moves a confusing case toward a clear one. Let's quickly bring this all together before I leave you with the challenge. This sign, the tricolor tell, shows up in somewhere between 1 in 10 and 1 in 3 people with Sjogren's. For close to half of those people, it showed up before the disease even had a name. It's triggered mainly by cold, and secondarily by stress. It tends to travel alongside a more immunologically active version of the disease, which is useful information, not frightening information. And the single habit that turns all of this from an interesting fact into something that actually helps you is absurdly simple. Take the picture. That's the entire hinge this whole video turns on. So here's the challenge I want to leave you with, and it's a small one, but I think it matters. The next time your fingers or toes do this, don't just wait for it to pass and move on like you probably always have. Take the picture. Note the trigger. That's genuinely it. One small habit, repeated a handful of times, and you could end up holding the exact piece of evidence that finally connects the dots, either for a doctor who's been trying to piece together your symptoms, or for yourself, if you've been quietly wondering whether what you're experiencing is even real. Now, here's the surprising part, and the reason I want you to stick around for what's coming next. This color-changing sign in your fingers isn't actually the only fading, easy-to-miss symptom that Sjogren's produces. There's a whole category of signs like this one, symptoms that appear, do something noticeable, and then vanish so completely that patients quietly stop mentioning them altogether, assuming they don't matter, or assuming no one will believe them anyway. So in the next video, I'm going to walk you through the other vanishing signs of Sjogren's that are getting dismissed the exact same way this one is, and why simply writing them down, the same way we just talked about, could genuinely change how fast you get real answers. If this video finally put words to something you've been quietly experiencing for months or even years, you're not imagining things, and you're not alone in having stayed quiet about it. A lot of this community has been carrying around symptoms nobody ever told them were worth mentioning. That changes starting now.